Iowa quarterback Cade McNamara suffered a non-contact knee injury last weekend where he was scrambling and essentially we saw that knee cave inwards. There was some speculation as to what exactly was going on with the knee at the time. There is an injury update regarding his case. It looks like that McNamara is dealing with a torn ACL and he's due to miss the remainder of the season. Now, McNamara's knee went into a knee position called dynamic knee valgus, and since some people may not be too familiar as to what exactly dynamic knee valgus is and why that impacts the ACL, I want to go ahead and focus on that with this video. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with this channel, I take a look at sports injuries and I go over them so that they're a little bit easier to understand. I also talk about the anatomy of the injury as well as talk about what that person should expect when in rehab. If you like this content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any comments or questions, please leave those in the comment section below. Now we can see here on the injury video that as he's scrambling and he goes to run, as he plants that leg, his knee just dives inwards like that, and that's what we know as the dynamic knee valgus position. Here I have a model of the knee, and so the knee joint essentially is formed by the thigh or the femur bone coming down to form the top portion right in through here. Then at the bottom portion right here, we have the tibia or the shin bone coming up to form the bottom piece. And we have this other long bone known as the fibula coming up on the lateral portion. Now there are 4 ligaments that contribute to overall knee stability. The first one, of course, is the anterior cruciate ligament or the ACL for short, which is located right in through here. Then as we go towards the medial or inside portion of the knee, this is the MCL or the medial collateral ligament. As we flip laterally or towards the outside portion of the knee, we have the LCL or the lateral collateral ligament. Finally, as we go towards the back portion of the knee here, we have the PCL or the posterior cruciate ligament. And then as I flip the model over here, there are 2 other structures. There is the medial and lateral meniscus right in through here. You can think of these 2 structures as shock absorbers between the femur and the tibia bones. Now, for the sake of this video, obviously we're going to focus on just the ACL. Now, the ACL has a few functions at the knee that essentially are very, very critical for knee stability. The first one is due to the attachment sites of the ACL, it's going to prevent something known as anterior translation of the tibia. And so a person with an intact ACL, when you do this test here, this is actually called a Lockman's test. This is an on the field or in the clinic test we can do to determine if somebody is dealing with a torn ACL. But basically we're going to stabilize the femur here and slide or try to slide that tibia coming forward. If we think we feel laxity on the injured side, we go ahead and compare this to the other side to determine if exactly what we felt was laxity. And basically from there, we can make an educated guess as to whether or not a person is dealing with a torn ACL. Of course, the gold standard is going to be the MRI, but that is one example of a test we can do. One other major function that the ACL is absolutely critical for is something known as rotational or dynamic stability. So as a person is going to plant in the ground and they're going to cut in a direction, that ACL is going to keep everything intact and keep that knee from essentially diving inwards, which is unfortunately what we see on the replay with McNamara. As he plants into the ground, we see it dives in for a second, and then that's exactly when he goes into the ground. So a lot of times when we see these non-contact knee injuries and we see the knee cave inwards like that, that is known as the dynamic knee valgus because the force coming from the outside in is known as valgus, and we call it dynamic because the joint is moving. Now, there can be other structures of the knee that are implicated in these sort of injuries, but essentially the sources have only said that he's dealing with an ACL tear. So let's go over the grading system for ACL injuries. There are grades 1, 2, and 3, where in a grade 1 ACL injury, you're getting stretching of the ACL. In a grade 2, you're getting partial tearing. And finally, in a grade 3, this is where you're getting a full rupture. Anytime a person is dealing with a full rupture, this usually requires surgery where they're going to do a full ACL reconstruction. So it sounds like in this case, he's dealing with the worst case scenario, which is unfortunately a grade 3. Rehab for this takes several months because essentially what we need to do is once the person has surgery, we need to get that quad muscle firing properly. So essentially, initially, the person is going to be in one of those big braces. We call it a drop lock brace. And this is going to prevent any excessive motion at the knee because you want to protect the ACL graft that they've used. Then as the person starts to improve with therapy and we can slowly start pushing on range of motion, this is when we start to work a lot on strengthening. And finally, at the 6 or 7 month mark, this is when we can start to work in sport specific movements. So unfortunately for McNamara, I have to agree that it looks like he will miss the remainder of the season because he does have an extensive rehab moving forward. So we wish him the best of luck with rehab. If I happen to hear any updates on his case, I'll be sure to update everyone in the comment section. Also, if you happen to hear any updates, please feel free to update me as well. If you like this sort of content, I'm gonna go ahead and link a playlist for other knee injuries that I've done. And if you like, you can go ahead and click on that and watch some of those. Thank you once again for tuning into my channel for today. I will be making more of this content in the future, and I'll see you next time.